My name is Emma Runswick. I'm a resident doctor working in mental health, and I am the Deputy Chair of Council at the British Medical Association, the BMA, a union that has pulled out more than 100,000 doctors on strike over 2024 for the cause of pay restoration. In the course of that 2 years since I was elected to that role, we've recruited 40,000 members, looking the trend from across the rest of the trade union movement. We've won 12 ballots, we've taken more than 50 days of strike action, and we have won between 10 and 24% pay rises, depending on what grade of doctor you are and where in the country you are. Non-pay based reforms, and we are still going in Northern Ireland, in Scotland for some groups of doctors, and now freshly the ballot is open in the Isle of Man, and we are now shifting towards local disputes on a whole variety of different issues. But we as a union were not set up in 2022 for industrial action. You might have read my contribution it's in the Morning Star and in the report about how disconnected from the rest of the labour movement the BMA is and has been. You might even recall the strikes that we had in 2016, which are in my profession widely considered to be a disaster, though it is much more complex than that, as it often is. When we had a whole series of cancelled strike actions, last-minute cancelled strike actions, last-minute changes to the way that we took strike action, really poor ground organisation, shocking organisation of picket lines that fell apart when, as doctors do, we rotated between workplaces. So activists and reps have fought to reshape the BMA. We have created networks ground up, and we created a strike fund for the first time ever. But there are some things that we really didn't have any access, ability, money, skill, time to do in the midst of organising the now almost 200,000 members of the BMA. So we had to look to somewhere else in the labour movement to support us for resources that we could share. And StrikeMap was one of the places that we found that. StrikeMap gave us a way of mapping our picket lines and sharing them online. When we had demonstrations and ran fewer pickets, it helped us to find each other across regions, and it brought supporters, including supporters with skills and resources, to our pickets instead of us having to do outreach. And that is really important given the position that we are in the labour movement, not TUC affiliated, often really disconnected from everybody else, and the exceptionalism that doctors often find themselves extolling. It meant that in a really massive contrast to in 2016, when we spent, to be honest, the vast majority of our time as activists doing outreach to trades councils, patient organisations, other political organisations, trying to get them to support us on the demands of kind of not safe, not fair, and contract demands. We had people who were approaching us, really frankly, for the first time, in a way that was much more coordinated and enables us to spend more of our own time on crucial organising work in our own workplaces that was necessary. Tonight, obviously, we've seen a new role for StrikeMap, assisting in the science of trade unionism, contributing academically as well as practically to the education and consciousness of our class. And in both of those roles, I think StrikeMap is going to continue to help us. Through it, we can know active solidarity, we can learn, we can grow, regardless of the role, union, size, profession that you're in. I think it's already been touched on, but if it is to be a successful tool, we do have to keep organising. The strike wave might be over, but the problems are not. Many workers are yet to make significant gains, even in the big unions. And of course, most workers are not organised in a union at all. For StrikeMap to be useful to us, there need to be strikes. We need disputes and we need to organise, and Henry's talked about organise now and therefore I do not have to say anything about that. For our part, it's worth looking a little bit at our dispute. The report, I think, has been quite kind in calling us the most resilient and long-lasting dispute. But it's worth looking at why that is. We have our own sets of problems. We have to consider patient safety when we take strike action. We often can't take long periods of strike action for reasons of cover. And there are good reasons that we were on strike a long time, right? We were on strike a long time because we didn't give up. You know, we outlasted several other unions where they recommended really poor offers, and had to fold early and they couldn't get their strikers out on the picket lines. But we also were long-lasting and resilient because we didn't win. We didn't gather enough leverage in the early period of the strike to overturn the significant pay erosion that we have faced from first Labour, then coalition, and then Tory governments. And we are trying to turn around our position. The BMA is attempting to catch up with most of you in the Labour movement and actually train our reps first time, have procedures for local disputes. We have now open disputes on study leave, study budgets, overtime, job plans, contracts, particularly getting people on non-standard contracts onto nationally recognised contracts. We are seeking recognition outside of the NHS, i.e. in the private sector, in places where doctors suffer really poor conditions with multiple jeopardy, often international staff facing threats against wages, and often the employer is also their landlord, often also holding their visa, often also holding their responsible officer for the GMC, and therefore the keys to their registration. And we are developing action in sectors where it's been very poor before or absent before. So GPs are currently taking collective action, not strike action, collective action for the resources that they need to give you good care. We all know what state general practice is in. We are focusing on about a quarter of doctors who are international staff, in whom our density has gone from 28% 2 years ago to 44% today. And we are sharing data with and supporting reps. And of course, we're building for next year's pay disputes, when I hope all of our unions will be able to coordinate better. But if we don't do that, then we won't win. So it's important to kind of return to a slogan that we have adopted, and I hope that other people will pick up, just as the TUC and others have picked up our pay restoration demand. If we stick together, if we strike together, we can win together. Thanks.